Hello Professor, my name is Manpreet Kaur. My student ID is 1156482448. I'm here to do the head to toe assessment. Here is the 360 view of my room. Hand hygiene is done. Privacy is maintained. Hello, I am your student nurse today. May I know your full name please?
My name is Deva Sachdeva,
Your date of birth?
14 June 2001.
Okay, may I check your band so that I will cross check with the documentation? Okay, perfect. Okay, I am going to do your head to toe assessment. Are you okay with it?
Yes, sir.
So moving forward, I am going to do neurological assessment first. In that, I am going to check the level of consciousness. Do you know where we are today?
Yes, at home.
What is the time?
11 o'clock.
Who am I?
My student nurse.
Okay. So the patient is fully oriented to time, place and person. Moving forward, I am going to check further. For that, I am going to dim the light, and now I am going to flash light in your right eye to check the pupil, as well as in the left one. Okay, for the consensual response, I'm going to flash light in the right one and check for the left one. Okay, please look at the tip of the pen as I'm moving forward. Follow the pen. Do not blink. Do not move your neck. Okay, so the pupils are round, equal, reactive to light and accommodation, and bilaterally accommodated. Moving forward, I am going to check the facial droop. Can you please smile for me? Okay, raise your eyebrows. So there is no sign of facial droop, and for the slurred speech, you have to repeat what I am going to repeat now. Okay, dynamite flower tip top.
Dynamite flower tip top.
Okay, so there is no sign of slurred speech now. Moving forward for the pronation drift, can you please stand? Okay, moving hands like this. Okay, close your hand and count for the 5 seconds.
1, 2, 3, 4, 5.
Okay, you can check now. Okay, so there is no sign of pronation drift. Pronation drift is negative. Moving forward, I'm going to assess the respiratory system. For that, I'm going to inspect interior and posterior. There is no sign of scars, bruisedness, and lesions. So I'm going to auscultate now the lung sounds. So there are 10 landmarks at the interior and 12 at the posterior, but I'm only going to do 6 at the front. Okay, can you please move back? So I did 8 point at the back. So in the auscultation, there is no sign of adventitious lung sound, no sign of crackles, wheezing sound present. And now I'm going to do check the bilateral. Can you please deep breathe? Okay. Can you say 99?
99, 99.
So the lungs are bilateral, and in the phragmitis there is no the vibration I can heard all over the lungs. Moving forward, I'm going to do the cardiovascular assessment. For that, I'm going to assess the 4 valves. Okay, the first valve is aortic valve, which is below the clavicle bone in the second right sternal border. For the pulmonic valve, below the sternum, below the clavicle bone, second intercostal space toward the left side of the sternum border. So the point is present at the third intercostal space toward the left side of the sternal border. And the tricuspid valve is present between the 4th and 5th intercostal space toward the left side of the sternal border. And for the mitral valve, it is located in the medial of the clavicle bone. I'm going to assess apical pulse here for the 30 second. So the apical pulse is 40. So the heart rate is 80, and the rhythm is regular and +2 strength. And there, during the auscultation, there is no sign of murmur and S3 or S4 sounds. Only S1 and S2 are present. Moving forward, I'm going to do the abdominal assessment. Can you please lie down? Okay, as I can inspect and contour, I can see there is no sign of abdominal distension and scars, lesion or bruises present. Now, so I'm going to auscultate the abdomen now. So below the navel, in the right hypochondric region, I'm going to start. I'm going to move forward with the clockwise fashion. So the vowel sounds are present in all four regions. Now I'm going to palpate. While palpating, if you feel any pain, let me know. Okay, do you feel any pain?
No.
Okay, so the patient didn't feel any pain. There is no sign of rigidity, lumps, mass present in the abdomen. So now I'm going moving forward to do the integumentary assessment, and here I'm going to inspect the body. So there is no sign of lesion, scars, bruises present. Now I'm going to assess the temperature of the body. So all over the body is warm to touch. There is no sign of coldness, and yeah. So now I'm going to check the nail buds. So the nail buds are pink. There is no sign of cyanosis. To check the capillary refill time, so it's less than 2 seconds. So there is no sign of cyanosis. So the skin turgor, I'm going to pinch. So as it moves quickly back, so the patient is fully hydrated and there is no sign of dehydration. So now I'm going to check the pressure points in the elbows, both the elbows and both the ankles. So there is no sign of redness, wound and disintegration of the skin. Moving forward, I'm going to do musculoskeletal assessment. For that, can you please move your hands like this and that? Okay. So the flexion and extension is present and it is normal. Now I'm going to put pressure. You have to resist me. Okay, so the muscle strength is +5 in both the arms. I'm going to repeat on your legs as well. So please put pressure. Yeah. The second one. Okay. Can you please flex your knee? Other one. Okay. So the extension and flexion is present in both the lower limbs as well, and the muscle strength is +5. Now moving forward to check the pulses. I'm going to assess the carotid pulse, which is near the trachea, cleidomastoid muscle. So checking the other side. So the pulse is regular, equal both sides. So moving forward, I'm going to check the dorsolateral pulse, tibial artery, which is located distant to the medial malleolus. I'm checking it bilaterally. It's equal and the pattern is normal. So the third one, I'm going to check the I'm going to check the dorsopedial pulse, which is located at the highest point of the metatarsal bone, just lateral to it. I'm checking it bilaterally. It's equal and regular. So we are done with the head to toe assessment, and here is the 360 view of my room. Thank you so much, Professor.